stand to address the House for 1 minute?
Without objection, so ordered.
Thank you, Mr. Speaker. You know, as we have worked these last several months on the issue of health care, I have engaged my community in a variety of town hall meetings, forums, and opportunities for them to let me know what they need out of a health care bill, to tell me their stories. I'd like to share one of those with you. My constituent writes, "This is not my story, but it is the story of a close friend who died last November at the age of 50. During his life, he was afflicted with diabetes and heart disease. He was self-employed, could not get health insurance because of his pre-existing conditions. A few months prior to his death, he asked me to review a brochure advertising a plan to get discounts on various things, including medical services and drugs, but clearly stated it was not insurance. I told him the company was not promising anything, only a hope discounts couldn't. He was going to pay the $178 per month premium anyway because he couldn't get insurance, any other kind of help. A few months later, he suddenly died." Mr. Speaker, we have an opportunity here with H.R. 3200 to pass a bill of historic proportions, to address issues like this constituent and many Americans are facing, to have a health care plan that is affordable and accessible for all Americans, that will lower the cost of health insurance and provide a public that gives people a choice of doctors and plans and puts an emphasis on prevention and wellness. I urge my colleagues to support this bill, and thank you very much.
Time, gentlelady, has expired. For what purpose the gentleman from Virginia rise?
To address the House for 1 minute.
Without objection, so ordered.
Thank you, Mr. Speaker. I rise today in strong support of H.R. 2920, the statutory Pay-As-You-Go or PAYGO Act, as a long overdue return to fiscal responsibility. We hear a lot from our colleagues and friends on the other side of the aisle talking about their newfound concern. But it was a Republican Congress that allowed PAYGO legislation to expire in 2002, even after, in fact, it worked.